Hello, dear friends. My name is Sofya Dorinskaya. I am a doctor and I run this blog, Evidence-Based Medicine. It is a pleasure to welcome you. And today I would like to answer the question about the video again. Safe choleretic agents. I received this question. What if there is no longer a gallbladder? How is it going there? What to do with choleretic agents? One doctor told me that all over the world the gallbladder is removed when indicated, of course. It is removed so that a person doesn't have to be afraid of eating anything. Please explain, for those who need it spelled out, how everything works without a gallbladder. And I have an acquaintance here. Here in Hungary, they also removed his gallbladder. And when we were talking, he told me that the surgeon explained to him that when his gallbladder was removed, apparently they somehow extended the duct, and he said that after some time this duct would expand. Well, it will kind of take on the shape of a gallbladder. Of course, it won't be a full-fledged gallbladder, but it will perform a similar function. Maybe that's already the case now, but these are just observations, yes, so most likely that's how it is, but let's look at the root of the problem. You see what the thing is? After all, there was some situation, right? Why was the gallbladder removed? And the first reason for this situation is most likely gallstones. And gallstones have a deficiency-related nature, primarily a vitamin deficiency. Why? Because when there is a deficiency of vitamin A, there is increased shedding of the epithelium inside the gallbladder, and actually in any other organ as well. And this shed epithelium becomes saturated with bile salts and then gets compressed into stones. Alright, a person has had their gallbladder removed, but did they address the root cause? Did they look at the root cause? After all, a vitamin A deficiency. It could be a consequence, it could be secondary to other vitamin deficiencies, for example, a deficiency of nicotinic acid, niacin. Why? Because the root cause could be a disorder of the gastrointestinal tract itself, and in that case, the cause is a deficiency of nicotinic acid. You see, and then the absorption of substances is disrupted, which leads to poor assimilation of vitamin A. This leads to consequences such as liver inflammation or other inadequate liver conditions. And so, for example, we end up with gallstones in the gallbladder, but the problem goes much deeper. So what am I trying to say? You need to unravel things all the way back to the beginning, you see? You can't just go in, cut out the gallbladder and say, that's it, now you can eat whatever you want. Why? Because the duct through which bile now constantly flows is also lined with epithelium. And if the original vitamin deficiency, the deficiency isn't addressed, if the whole chain that leads to the deficiency isn't resolved, then the same thing will happen there. There will also be increased shedding of the epithelium, and it will also become saturated with salts. Do you understand? There is also evidence that this duct, after the gallbladder is removed, expands and becomes something like a pouch, so the same thing will happen there as well. That's why, in this situation, but it doesn't directly show which vitamin deficiency exists, though it can be secondary to a vitamin deficiency or itself be a secondary issue. So here, of course, it would be better to unravel the situation from the beginning and start addressing the root cause of the problems. You see, that's exactly what happens. We're just cutting off the tail of the problem. But unfortunately, no one is dealing with the original issue. Because, of course, that's not the surgeon's job. It's the job of therapists. But unfortunately, the degradation of therapeutic knowledge. At the present moment, it just disheartens me. It disheartens me. Let me remind you that therapy used to be considered the queen of medicine. Because when you apply the data correctly, you get fantastic results. Fantastic results. Do you understand? People restore their endocrine systems. They stop taking the same thyroxine. They avoid surgery. People's stones disappear. Well, if it's huge, of course, it might take several years for the body to dissolve it on its own. But nevertheless, if it's sand, it goes away because sand is also a sign of vitamin A deficiency. It's just that the particles are smaller, they haven't compacted yet, these sloughed off epithelial cells. Little by little, it gets saturated, and that's how the sand forms. It hasn't fully formed yet. And there are a huge number of problems. Cysts. We even have a case where microtumors disappeared in the brain and in the endocrine glands. And then on the tomogram, there was a sign that the body simply encapsulated this tumor, forming what's called a calcinate. That is, it saturated the tumor with salts, and that's it. The tumor stopped growing, and naturally, the person experienced improvement. This improvement happened in their condition. In other words, the body has a huge number of tools and mechanisms to deal with its own problems. The issue is that it can't use them because the body needs tools for that. And the body's tools are nutrients. If you know how to properly provide the body with nutrients, all of its problem-solving tools are activated. That's all there is to it. You just need to understand what's happening, continue, and seek medical treatment from a doctor if a secondary pathology is discovered. And if it requires medical intervention like antibiotics, that means it needs to be done. But nevertheless, the body's resources start working at full capacity. If you don't do this, then we'll just keep chasing symptoms and nothing will change radically. So, well, I hope I answered your question. I'd like to ask those who watch our channel without subscribing, please subscribe. It's free for you. And for those who have been watching our channel for a long time and are subscribed, it will be nice because when we reach 500,000 subscribers, we will raffle off these 3 sets of these wonderful books. On vitamins, this is by Professor Ilepsky. Hypovitaminosis in Childhood. Introduction to the Clinic of Vitamin Deficiencies and Hypovitaminosis, and On Vitamin Deficiencies and Hypovitaminosis. These books contain lost knowledge about vitamins. They are genuine scientific data. These books are written in simple language. If there are any unfamiliar words in the text, well, if a person knows how to use a dictionary, they can manage. These are fairly easy to read books where everything is clearly explained, and we found these books and restored them for publication. These books are unique. So when we reach 500,000 subscribers, we will give away 3 sets of these books. And once again, I want to say, if you're watching without subscribing, and about 30% of our viewers aren't subscribed, please subscribe. Then we'll be able to give away these sets of books quite soon. I want to remind you that the Center for Medical Information conducts screening tests for nutrient deficiencies. This testing shows what is happening inside the body's cells, and based on these findings, we can create an individual vitamin and mineral plan for a person and guide them on the path to eliminating deficiencies. So if you need this, if you feel that you need it, qualified guidance, please come, we will be waiting for you. The website is dorinskaya.com. Please write to me. I communicate with everyone and answer all questions. Thank you for your attention.